In December 2022, President Dr. Irfan Ali announced massive salary adjustments for healthcare professionals and nurses. This significant move signaled the government's commitment to providing nurses with adequate remuneration. However, on Monday, Health Minister Dr. Frank Anthony acknowledged that months later, some nurses are yet to benefit from the adjustment. He insisted that these discrepancies will be sorted.
I understand that in some of the regions that this is not, there might be a few discrepancies, and if there are those, we need to address them. Recently, I was in Regions 5, and I understand that there are a number of nurses, although this has been past several months now, that the persons are not getting the appropriate salary increase.
The increase will now see registered nurses with starting salaries of $170,000 monthly, among other adjustments for doctors. The increase followed multiple calls for better conditions for nurses and the shortage of nurses due to them migrating to different countries for work. Dr. Anthony said the nurses must benefit from this significant adjustment.
So if there are any person in these various categories, and we can make all the categories and the salaries that they ought to be getting. If there are anybody who is having those deficits, then we need to fix them. And we need to do that as quickly as possible. So we can't announce salary increase and then there's still people who are not getting them, right? But by and large, I think everyone has benefited from the increase.
The government also outlined plans for improving the profession of nurses, a major component of which includes a mass training program and the specialization of more nurses, and intends to train 1,000 people annually through an expanded nursing program that started this year. Despite the efforts to retain nurses, the numbers are dwindling, and Dr. Ali last week announced that the country is looking to Cuba for some short-term support. Reporting for the newsroom, Lazina Yearwood.